Good morning, everybody. Thank you for joining us for this webinar that's going to introduce the host network. I'm going to start by going over the agenda, and then we're going to take a minute and do some housekeeping, and then we'll launch into the webinar. So as you see, the first item on the agenda is housekeeping, because we always have to do that. And then we are going to welcome you to the host network and explain what it is. Then we're going to show you an overview of what we're doing with the host initiative. There's a nice video we have to show you. And then we're going to have two parts of host in action with two of our collaborators. I'm going to have a conversation with Tia Newman, who is one of the people that we work with in DC. And then Ray Parks, one of our partners, is going to talk about financing services in assisted communities. And then we will have Q&A. So if you have any, so let's go to the housekeeping. This webinar is being recorded, so if you miss anything, you can always get on our website and find it later. The slides and recording will be sent out after the webcast. All the participants are muted. If you have questions or you're having a problem, please type your questions into the question box and we will get back to you as soon as possible. If you have questions later, you can send them to events@urban.org, and please follow us on Twitter at live@urban. Speakers today are me. I'm Sue Popkin. I'm the director of the Host Initiative at the Urban Institute. Tia Newman, who is our community outreach coordinator here at the Urban Institute, and Ray Parks, who is a partner at EJB Consulting Group. You can find longer bios and more information about all of us on the website. So I am going to start by welcoming you to the launch of the Host Network and by explaining what you've signed up for. What is HOST? So HOST stands for Housing Opportunities and Services Together. It grew out of a decade of research and partnership with housing agencies and service providers. It began with work in Chicago with the Chicago Family Case Management Demonstration. That was a partnership of the Urban Institute, the Chicago Housing Authority, and several service providers. And the demonstration was it was a much more traditional research project. It ran from 2007 to 2010, and we found some pretty exciting results for the people who participated. They got wraparound services, the case management with low caseloads, mental health services, and transitional job services. And at the end of the demonstration, we found that people's mental health had improved, their physical health had stabilized. They were people who were going through relocation at the time. They had relocated successfully for the most part. But we had some concerns about the kids. The kids didn't seem to be doing as well. And we tried to think about, with my collaborator, Mary Howard at the Chicago Housing Authority, about how we would really design something that met the needs of the whole family and took a two-generation approach. And that became the HOST demonstration, which started in 2011. And it was with three housing authority partners: Chicago Housing Authority, Home Forward in Portland, Oregon, and the DC Housing Authority. And you'll hear some more about that in a minute, about what we learned from that experience. But that was has served as a laboratory for how you figure out how to integrate services into housing and really meet the needs of whole families. We currently have a number of partnerships still with different housing authorities. You can see on the slide. Still working in Chicago, Portland, and DC, and now with the Bangor Housing Authority, and all of that builds on this research. The core elements of HOST are that it involves coordination, collaboration, which you're going to hear a lot about today, and leveraging resources. So we're not expecting housing authorities to be able to come to the table with all the resources they need to be able to provide the services to their residents. I think one of the really key elements of HOST is that it meets residents where they are. This is not a sort of more traditional compliance-oriented case management approach. It's a strengths-based coaching approach. So letting people set their own goals, figure out what they need to move forward and what makes sense for their families. I think another core element is that it incorporates clinical mental health services that are on site, which we have found to be absolutely critical. In workforce development for adults, and integrates youth services, which is, we can talk about more, sort of challenging because you need services for kids of lots of different ages, and therefore people can work with kids of different ages. As you can see in that picture there, they go from really little kids to middle school and high school. It takes a very intentional two-generation approach, and it's intensive case management. The caseloads are low. They are capped at 1 to 30. We have learned a lot of lessons from all of this work, and you're going to hear more in the video in a minute, but really, I think the core is about coaching and relationship building. Creating relationships with families and building trust takes time. A lot of these families have been through a lot of programs over the years. They've had a lot of bad experiences. They have been experienced a lot of times where programs have come into their communities and left again and left them with what they felt was nothing. So it really takes time to create the relationships with the families and build that kind of trust. As I said before, it's really important to meet the families where they are, not coming in and assuming you know best and what's going to work for each family. And then I think one of the lessons that really comes out of this work is this is hard work for staff. This is not something you can just send people out to go do and they're going to be fine the next day. They need support and training for dealing with families who are dealing with themselves with high levels of trauma and complex needs. So you really need a very intentional trauma-informed approach for the families and for the staff who are working with them. In the current policy environment, some people might say, why do this now? The funding is so limited or maybe so uncertain, I guess, after yesterday. But I think that the lessons are especially relevant now. The policy changes that we're going through right now and the uncertainty means we need effective tools to serve families. There have been cuts to the public housing and affordable housing financing. There's a lot of concern about what the effect of the tax cuts will be, whether that will reduce financing for redevelopment. So we need to be creative in using money effectively. And also there is increasingly the possibility that there's going to be a conversation about imposing work requirements and time limits, and that means families are going to need more support, not less. So we have moved on from the demonstration. We are taking the lessons out into the world, into what we call the host network, and now I'd like to invite you to watch this video that explains what we are hoping to do next.
House. Opportunity and services together. HOST is a research initiative of the Urban Institute. The HOST team at Urban focuses on designing and testing effective two-generation strategies to promote the well-being of families who live in subsidized housing. We use various evaluation methods, formative, outcome, participatory, and research demonstration, to produce insights and approaches of value to policymakers, agency executives, resident leaders, developers, and human services providers. HOST emerged from years of Urban Institute research on government-driven attempts to improve the lives of families living in the most distressed public housing in the United States. Our research shows that despite stable housing, families often face persistent economic and social hardship on account of linked challenges such as economic hardship, trauma, under- and unemployment, low education, violence, substance abuse, inequality, and discrimination. The HOST demonstration tested strategies that used public housing as a platform to provide intensive wraparound services to both parents and children in order to stabilize families, promote better educational and workforce outcomes, and strengthen communities. The demonstration took place in 3 cities, Washington, D.C., Chicago, and Portland, Oregon, from 2010 to 2015. Working with our partners, the research team overseeing the HOST demonstration emphasized bringing 3 core components directly to public housing properties: tailored and integrated two-generation services, which included workforce development for heads of household, developmental and educational support for children and youth, and mental health support for both generations as needed. Strength-based coaching, often part of intensive case management or services navigation, which cap caseloads at 1 worker to 30 families, and deep collaboration with all partners, including resident leaders and participating families. Based on findings from the HOST demonstration, Urban researchers have identified several key lessons about using housing as a platform for services. This includes addressing residents' basic needs related to property management or other resident priorities, such as safety. It is also important to recognize residents' challenges and barriers connected to a history of trauma and other mental health concerns. Our research also found a high level of food insecurity in public housing communities, an important issue to address through services and supports. HOST two-generation model provides key lessons on serving youth and families. For example, youth require a wide range of different service supports. Having separate service providers who tailor programming to specific ages and collaborate closely with the adult service providers is essential. In addition, the demonstration found that getting youth involved up front often leads to parental engagement later. The importance of stability also emerged as a key theme in the demonstration, with continuity of staff essential to high resident engagement rates. Additionally, supporting residents leads to lower lease violations and more stable housing. Coordination between stakeholders is crucial. This includes coordination between different service providers, between property management and service providers, and between the housing authority or providers and other agencies and resident leadership groups. Host partners have found that customizing these lessons learned to their communities can address various interlocking issues that families face and move their services into a web of support, including mental and physical health, employment, education, and positive youth development. Now that the HOST demonstration is over, we continue to build on our findings through a community of practice we call the HOST Network. The HOST Network functions like a test kitchen for designing housing as a platform for services, allowing partners to draw on urban research and the wisdom of other members to develop recipes for success, balanced to meet the needs of diverse people and places. Network members include housing agencies, public housing authorities, resident leaders, private developers, human service providers, and nonprofits that promote the well-being and economic advancement of families in subsidized housing. There's no fee to become a member, just sign up on our mailing list to join. We use the test kitchen metaphor because HOST is not a cookie-cutter approach. Rather, it's a resource that supports new ways to cook up social and economic success for and with families. The HOST Network delivers a robust array of resources on how to design, finance, and collaborate to produce the best possible mix of supports for a diverse range of families across different places. Our design-oriented research findings, guidance materials, and convenings address substantive service delivery issues, such as implementing a two-generation approach to services, working in communities with high level of trauma, and addressing food insecurity. Our finance-oriented offerings review and build on the mechanisms housing providers and other partners use to pay for services for families in subsidized housing. Finally, our collaboration-oriented offerings provide insights on the various ways stakeholders of all types can share knowledge, experience, and resources. This includes how to engage residents in leadership roles and how local housing and service providers can come together for collective impact. The Urban HOST team is available to engage partners directly in action research, to support customizing local program models, tracking and analyzing continuous improvement data, providing technical assistance when programs are implemented, and measuring outcomes for families over time. So take a look around the HOST site, use our research, and sign up to become a member of the HOST Network. Join us and other like-minded partners in bringing housing, opportunity, and services together for vulnerable families across the country.
So we would invite you to take a look. One of the reasons that we're having this launch today is that we are launching our new webpage, which will show up on your screen momentarily. There it is. And we would invite you to click around and see the different resources that we have. And we will be adding new things regularly, sending out announcements to everyone who has signed up. But we have all kinds of materials we hope you'll use, and we hope you'll get in touch with us to find out more. But today we're going to let you hear about some of the collaborations that we have. And we're going to start by one of our collaborations with someone who lives in public housing and has been our collaborator for a very long time and also works at the Urban Institute. So I'd like to introduce my colleague, Ms. Tia Newman. and just ask you to talk a little bit about what your role has been. You're on.
Oh.
So what have you been doing with us for the past 6 years?
Oh, Lord.
So explain a little bit about you.
Yes, because today is.
All right. So Tia is both our community liaison for the work that we do in DC Public Housing, and she's also a resident of the Benny Terrace development. And can you just talk a little bit about the kind of work that you've done with us? You do a little of everything.
Yes, I wear a lot of hats. I'm like the liaison between the residents, DCHA, and Urban Institute. Just, Lord, trying to teach the residents and stuff and the parents about the two-generation approach that Urban is implementing in the communities and stuff, and letting them know that it's healthy to have services on site and meeting the residents where they at. That's kind of like.
So why does it? It's okay. I know. I'm sorry you're not feeling well today, but can you tell us what was different about Host than other programs that you've had on the site in your community? What made you decide to work with us?
Because it's helping the parents and the kids. If the parents and their trauma and their barriers are being helped, then they can help their kids better succeed in life, and teaching them stability and stuff. And all the programs having East of the River on site. So if they needed to talk to someone, they didn't have to go and find some organization that's off of the development that they lived in. They had someone actually there that they could talk to concerning their housing needs, mental, food, insecurities and stuff. And then I liked it that it had a separate programming just for the kids, and that our voice was being heard. You know, and that's the big difference, because some of the organizations usually just come in, get what they want, and then they leave. The difference is that Urban allowed, excuse my throat, allowed us to be heard in the needs and stuff, and that what we have to deal with on a day-to-day basis.
You really helped co-design the program for the teams, right?
Oh, yes. We're working on the curriculum long hours, a lot of meetings, but it was all worth it, and that's why I continue on doing the work, because I believe in Host. And, you know, and it's a very good program and two-generation approach that everybody needs to grasp onto, because you need to meet people where they at, and that's how you will learn more, and then you'll get your better outcomes and stuff with your research.
And one of the stories you told me the last time we talked was about why it mattered so much that the service provider was on site when there was a crisis.
Yes, Lord, yes. We always have several incidents and when you could coming in public housing communities. But one incident specific I can remember, a young lady, little son found a gun in the house and accidentally shot his 3-year-old sister, and she lost her life. And it was good that East of the River was there on site, because they was on hand, able to help the parent, you know, the mother and the siblings and stuff through the crisis. And then only with the residents, they invited different Department of Health, different agencies to come on site for a few days for residents to talk and out, you know, their concerns and stuff, because that was a big loss in our community for her to be so young.
And I think the other thing you told me was really important was the long-term commitment
For
that they were there.
yes.
They didn't just come and go.
No, they didn't come and go. And as a matter of fact, and they're still there. They're coming back now.
Yeah.
And stuff, yes.
So they're still connected?
They're still connected, and I have used East of the River. We have had several cases with residents that needed help. We had a father that came on our property raising his kids, but he had some substance abuse issues, so I was able to get him connected with East of the River. Ms. Wesses, who was my contact person, she always sends someone up there. We had another young lady, the CFSA needed furniture. We was able to collaborate with her case manager with CFSA, have monthly meetings with her to try to get her and her family back on task where she wouldn't lose her children, because it's not about no one kids getting taken away from them.
Why does it matter that the services were on the property and instead of having people just go down to an office? Why does that matter?
A lot of people, one is afraid of leaving their comfort zone, and you know sometimes it's better to have the services on hand and on site for them. Then they're better utilize it than them trying to go across town, and then you know that funding, you know, because a lot of them don't have a lot of income because TANF have changed over the years, so a lot of them don't get income to get back and forth to their doctor's appointments, mental you know, Department of Health and stuff, whatever
For the comfort
things,
zone.
yeah.
And my last question to you is, what's it been like working with the Urban Institute, which is
Lovely.
really a research organization, but we're trying to be more on the ground now.
It's really been lovely, and I greatly appreciate that they gave me the opportunity, someone that lives in public housing and also have, you know, a background of working with youth and stuff, the opportunity and to have our voice be heard, even though I'm one person, but I get to travel and get to talk about this, and I really enjoy it. So I'm very appreciative of that.
Well, thank you so much, and thank you for coming in today.
No problem.
So now I'd like to turn this over to one of our other collaborators, my friend Ray Parks, who is a partner at EJB Consulting Group and a former colleague at Apt Associates many, many years ago when we were children. And she is going to talk about financing services in public and mixed income communities, which I know is a great concern to everybody who's on. So take it away, Ray.
Thanks, Sue. Thank you, Sue. So what I'm going to talk about today is at a fairly high level about generally how some of our clients have been attempting to finance supportive services for the work that Sue has just talked about. And what I'd like to emphasize is this notion that at the end of the day, folks are needing by necessity to layer on a range of different kinds of financing opportunities and trying to figure out how to leverage tools that they have, figuring out how to create new tools if they don't have the tools that they think they need. But at the end of the day, there's a recognition that the work that we're talking about is not only hard, it's also expensive. And to do it well, you need a lot of money. Sue talked about a caseload ratio of 1 to 30. Well, if you have a large client population, then given that kind of ratio, then you're talking about needing to raise a lot of money, and that is not an easy thing to do in this particular climate. So what we have learned is this idea that in order to be able to raise money and to sustain that type of funding that you need, service providers, housing authorities, and their partners need to be able to make the business case for supportive services. That it's not enough just to talk about services for the sake of talking about services, but what is the business case here, and to be able to translate that in the language that funders and other partners will understand. And probably the biggest reason that this matters is really this idea that if you invest in services, if you invest in the support for the families who live in these properties, it directly impacts then the physical assets. And what we're talking about ultimately, for example, is that the more stable the families are in these communities in which we are working, it results in fewer turnovers, for example, fewer calls for management, and so on and so forth. So that is one important example that we have found that service providers need to emphasize and be able to quantify and monetize what that might be able to look like. So we speak the language of development and finance, in addition to speaking the language of supportive services. The challenge we know is acute. If you are a public housing client, for example, we know that you are not receiving enough funding from the federal government to just basically operate the units that you now have. And even though there is a transition right now that is being pushed nationally towards RAD, that is still focusing more on the physical side of the house and less so on the services side. But we are recognizing the fact that this conversation is happening in an era of dwindling federal resources, and we are not seeing that this is going to get rosier anytime soon. So really, we're just making sure we acknowledge this. And in spite of that, though, because the need for supportive services is still so great, now we're transitioning into talking about what are some of the strategies that we have seen tried and have succeeded to varying degrees across the country. Now, when we start to talk about strategies, one of the things that we have learned before you can start talking about asking folks to invest in supportive services, we have found that it is essential that you have a plan. What exactly is it that you are wanting to get partners to invest in? Why? What is the data that suggests this is the right set of strategies that you are going to prioritize? Who are you trying to serve? And what are the goals and the outcomes you're trying to achieve? We find that if you do not start off with having a plan that is customized for the clients that you're trying to serve, that is responsible and flexible at the same time, it's going to be very hard for you to be able to then generate the kind of resources that you're going to need. However, when we talk about a plan, we're also talking about the need for these plans to be flexible, because the needs of your families will change over time. And so therefore, we can't assume a plan that is going to remain fixed over a period of time. So step one, we believe, is you need to have a plan. And then the other thing that we have found is that it is important to make sure that there is a clear understanding of the organization in which you reside. The organization framework is important because if you do not exist in an organization that prioritizes supportive services, it's hard to make the case internally for why investing in services is important. And then it's hard to get the support that you will need to be able to make the case externally. So we have found that there are a couple of basic things that need to be in place, right? So does the organization's mission and vision prioritize services? And what is the organizational culture? Is it supportive of this endeavor? And does it view the work that you're trying to do as adding value? And importantly, are there policies that are embedded in the organization that are clearly articulated across the board that places value on supportive services? So what does that mean? What it means is that supportive services then is seen in a similar light as any other line of business at the organization. And then it gets treated as a priority and as value added. And then what this allows for then is, rather than thinking about deal by deal or project by project initiative or funding source by funding source initiative, then you're really talking about a comprehensive plan of the agency. But then you're being opportunistic about how you then shop that, how you then realize sources of financing, and so on and so forth. So this part is important to make sure there's a scan of the organizational culture in which you exist, and that allows you then to calibrate your internal strategies appropriately. And it may mean that you're needing to then also push at making sure that the organizational strategic plan supports or embeds supportive services as a value. So then the next thing that we see in terms of strategies now is the need for integration, right? A lot of times we have found that something like relocation, for example, that many clients will have to undertake is separated or segregated from the delivery of supportive services, right? And we see this as one of the fairly straightforward ways in which, by simply just reorganizing and integrating relocation with supportive services, there is now sort of a built-in mechanism to be able to fund this as more of a blended program. And why does this matter? Well, this matters because in most cases, relocation is a line item that can get funded inside of a development budget. And all of a sudden, if you're blending relocation and supportive services rather than have these as two completely separate tasks, then you're able to leverage your relocation budget in a different way and in a more efficient way. So this is one of the strategies that we see, and we would recommend that you want to think about where you're doing relocation. Can that be integrated with supportive services? Because for one, it's going to be less staff that you will need. So rather than two different sets of staff, it's now a single staff, which translates into savings in a way that can be tied back directly to a development budget. Another major thing that we see, and increasingly our clients are investing in this, is direct fundraising. There is not enough money inside of a housing authority agency to be able to invest at the level that you ideally want to invest in to realize the outcomes that you want when you're talking about a pretty low client to case management ratio. So you now need to be thinking more broadly about how do you raise capital to support services. One of the things that we see and we recommend is the idea that there is somebody's job it is to be, one, beating the bushes, identifying the funding opportunities, tying that back to the plan that we talked about earlier, but on a day-to-day basis, somebody is waking up every day trying to figure out where are the opportunities, what is the federal landscape, what is the local funding landscape, and implementing a fundraising plan. This is essential. And there are different ways that you can pay for this, but we're finding that this is really essential. The other tool that we increasingly see that our clients are using is really leveraging in-house agency-supported or agency-affiliated nonprofit entities. And why does this matter? It matters because in some cases, if you're a housing authority, there may be some funders who don't want to give directly to a housing authority. And so this creates a pathway for folks who might be otherwise reluctant to provide funding directly to a housing authority to fund a plan or to invest in a plan. And so thinking about either establishing a nonprofit affiliate, or if you have one, figuring out how to use it more effectively is a tool that we are seeing increasingly across the country as well. Another tool that we see is this idea that you do not need to go this alone, and that you might be better off partnering with somebody else to secure or chase other funding. And it is here essential that you are partnering with really, really strong and organizations that have deep roots to the population you're trying to serve, so that you're able to sustain a relationship over a period of time. Another thing that we see is a lot of times the relationships with local government sometimes get overlooked. And many local governments, whether it's the city or the state, often will have resources that will be beneficial for the population that you're serving. And so the trick here is trying to figure out, how am I aligned with my local government? What are the pots of money that they might have? Or even, am I able to influence the budget cycle in such a way then that there can be a conscious effort in terms of your city or state partners in terms of investing in the plans that you have. Philanthropy, this goes without saying, the need to expand your efforts in identifying and cultivating relationships with national and local foundations, both large and small. And some of the examples that Sue has talked about, and you'll see on the host website, many of these have large foundation partners as well. And while it's not going to be possible for everybody to have a large infusion of philanthropic resources, the idea is you might start small and then expand that pot. And lastly here, in terms of direct fundraising, obviously always looking at the federal landscape, and there are a range of competitive and grant-funded opportunities that might be available to fund supportive services. Obviously, the largest one on the radar right now is Choice Neighborhoods, but who knows if that's going to remain in the budget. We are scanning the current landscape to see if that's going to be available. Obviously, that is a very, very competitive grant source, and not everybody's going to get it. And so we emphasize the need to be able to be building funding strategies that do not rely on this source, because it is not available to everyone. Then moving to the next slide, we have found, and this goes without saying, this is something that I'm sure everybody knows already, the importance of partnering well. Absent strong partnerships, it is not going to be possible for, and I think I might have jumped around on the slide here. So I'm going to ask our slide manager to scroll back up 2 slides. I'm missing a couple slides. Right. So leveraging development transactions. This is not applicable to everybody, but for folks who are involved in development, we have found it is essential to leverage your development transactions, and you may be able to generate not insignificant amounts of financing to support supportive services. And this can come in a number of different forms. On the front end, in terms of getting line items to fund either relocation, or on the back end to generate revenue through the operating budget. And so here, there are a couple of specific things that I want to touch upon that you might be able to leverage depending on what is going on with your agency. Again, as I said, if you're not doing development, these tools may not be available to you. But at any rate, here we go. So developer fees. Oftentimes, housing authorities might be participating in a development transaction and earning a fee. And while there are sometimes restrictions on how some of these fees and program income can be used, we have found that making the case that some portion of these fees can go to invest in supportive services is important. And again, this is why it's important to have a plan up front, as well as internal policies to support the investment in services, so you're not trying to get this done on the back end. Sometimes, if it is possible, and depending on how you structure your negotiations with your developer partner, and assuming the investor supports this, we have seen in cases there can be an agreement to use any construction savings, some or all of it, to fund a supportive services escrow or direct investment in supportive services. Operating budgets is a place that we often see we can make the case with your developer partner and with your property management entity to finance a position or some type of direct training or support inside of the operating budget. Now, obviously, the operating budget needs to be healthy enough to support this kind of line item, but we find that supportive services partners need to be at the table to make the case that this is something that should be in the budget. And then you can talk about what the level of that support could look like, because obviously the deals need to work. Cash flow. Oftentimes, housing authorities are negotiating some participation in net cash flow, and we see that this could be an area that housing authorities or nonprofits can use to invest in seeding a supportive services fund or ongoing investment in direct services. Same thing about ground lease payment. These are streams of income that may come back from a deal, and the question then becomes, what do you use those streams of income for, and could some of these streams be used to support services? Some of these have strings, as I mentioned, but the goal is to be able to make the case for whatever streams of income that are returning from these development transactions, to then use some portion of it to finance supportive services. And then we go to our next slide. This here is really trying to emphasize the idea that there are tools that you may have right now at your disposal. And the question then becomes, how are you leveraging them? How effective are these tools? And then if you don't have these tools in place, might you be able to get some of these tools in place? Some of these are unique just to housing authorities, but some of them are not. One of the tools that we see that increasingly we are pushing and our clients are thinking about in different ways is really just looking at the Section 3 legislation, because right now it does say that for Section 3 eligible projects, you know, you're talking about both employment opportunities as well as construction dollars to Section 3 eligible businesses. Well, we have also seen that some housing authority clients, at least in this example, where their partners are not able to meet those two criteria, they may create alternative ways for folks to become compliant with this program. And one of those tools is the ability to invest in a training fund tied to Section 3 compliance. So this is something that you may want to explore if this is a tool that might work for you. There is the moving to work designation. Again, this is unique to housing authorities, but for those housing authorities that can get this designation, it allows for significant flexibility in terms of how you use the funding you receive from the federal government to prioritize and invest in supportive services. Most housing authorities that don't have this designation are far more restricted and limited in how much money they can invest in supportive services, whereas if you have this designation, you can propose any kind of innovative supportive services program and then fund it, because you are then able to have much more flexibility in your funding path. There are obviously some limitations. There's some grant funding that you can't actually commingle in this way, but other sources that you can. And then these last two here is this idea about alignment. Alignment both with city and state agencies, and then alignment with local anchor partners, right? The idea here is you are not trying to figure out how to do this alone, but you're thinking about, how do I partner with local government, state government, as well as these champions who are in your community delivering supportive services and serving your population. And then lastly, this idea about the need to partner well. We are seeing that it is essential to figure out who is in your community, both near and far, that have shared values with you, that are trying to achieve the same kinds of goals that you're wanting to achieve, that is already funded to serve the kind of population that you are funding, And that while this doesn't always translate into money and cash for you as the housing provider, it's really about trying to leverage these relationships so that you are able to deliver services to your population, and that you are then ensuring that some of these services can be sustained over a period of time without necessarily having to bring in new dollars, because that's where the scarcity comes in. We have found, though, that for these partnerships to work, it is important that there is a level of depth that is beyond just the heads of the agencies, because sometimes we have found that when people change, who may be the leaders in these positions, if those partnerships are not deep within the agencies, then sometimes they will fizzle out. And so this is one of the lessons learned here. And that we're also talking about, over time, the most lasting partnerships are one that just have deep roots in that community, and that they're not going anywhere, and they're able to withstand the ebbs and flows of funding up and down in the marketplace. So this is really sort of a high level look at some of the tools we have seen work across the country, as well as some of the lessons we have seen based on some of the work that we have been involved in as well. So I'm going to stop there and hand back over now to Sue.
Thank you, Ray. That was terrific. And I need you to stay on because we have questions, and most of them are for you. So I'm going to start with one from Kathleen Julian, who follows right on what you just said. She said, it's very nice to say partner well, but how do you even get a foot in the door to partner?
Right. So, I mean, first of all, we'll acknowledge that. So the coming back to this idea about the plan, right? What is it that you are trying to do will matter. Because then when you're thinking about who are you going to partner with, you're really trying to figure out, if I am really trying to push X, which partner is similarly aligned with the X that I'm trying to push. So that's one thing, right? Because you don't want to be just approaching partners randomly, right? You need to be able to speak to what it is they're doing and how that is aligned with what you are doing. So that's one thing. The second thing we've seen in terms of the how you try to establish these relationships is knocking on doors and networking, and whether it's somebody on your board that has a relationship with that partner that you're trying to cultivate a relationship, or whether it is some distant relationship through somebody, you are really trying to figure out, how do I get access to that particular partner, and then start there. And frankly, don't underestimate the notion of trying to literally go knocking on their door and trying to get an audience with a partner or a group of partners to talk about a vision, a plan for what you want to do, and then cultivate a relationship. We can say with certainty that the partnership development takes time. This is not a one and done, and sometimes it will take you months or even years to be able to bring home a partner in a way that we're talking about here. But you're going to want to stay at it, but you also want to tie that to a plan and tie that to something that they are interested in, either because they're receiving funding to support the same population or a similar population that you serve, or because their strategic plan is somehow aligned with yours. But you gotta, sort of boots on the ground trying to find these partners and making the case for why this partnership is in their best interest as well as in your best interest as well.
Thanks, Ray. I have a couple that could be for either of us. I'm hoping you maybe know the answer to these, and I'm going to lump them together. One is from Solon, and he had to step out, but he wanted to know if we knew about anyone who had done successful impact investing or paid for success models in this area. I haven't. He also asked about cost savings across complex systems and leveraging the savings for financing opportunities. We did do a cost analysis in the Chicago Family Case Management demonstration, but not a one that would allow you to see the cost benefit across a range of programs. We're trying to do that with a project I'm working on with the Annie Casey Foundation right now, and so may have some information about that. But Ray, do you have any knowledge about that at all?
Well, no. So yes and no. So what we're finding is, so there is a more expanded conversation going on right now about social impact investing, but I think that that is still relatively young, and there is not yet a lot of data in terms of how successful it has been, particularly through the lens of services. But I think that we think that this is going to be a growing field because there are increasingly any number of investors that are trying to look at kind of a double or triple bottom line, and this idea of, again, making the case for why they should invest in the plan that you're putting forward is important. But there is not a lot of kind of hard evidence at this point in terms of how successful or less successful. And this is where kind of looking at your local community and whether or not you could even help create kind of a pool locally by even starting with a single anchor partner. At least this is something we are exploring in a couple of the communities we're working in right now to try to figure out how to create a pool like that that not only supports services, but also development. We're finding it's hard to just segregate out services, but if it's tied to development with an explicit goal that there is also funding for supportive services too, it's easier to make that case. So unfortunately, I don't have any great examples right this minute in terms of has been done and they're great, there's research on it.
All right, good. Quick question was, do we have any idea when the Choice Neighborhoods Awards were going to be announced? And I don't, do you?
Well, the rumor we've heard, first of all, it should have been out. We were hoping it to have been out now. There are 2 awards that are pending. One is the planning grant, and they appear to be a little bit.
That's the one people are asking about.
Right, so folks they're a little bit behind schedule on what they had said they were going to award, and then April was the implementation grant. That was the projected schedule. So any day now, we hope, on the planning grants anyway.
Okay. We're getting low on time, so I'm going to combine some of the questions about services here that we've gotten from Tirza White and Michael Bonovich. I'm sorry for butchering names. About how the meeting residents first and differs from top-down supportive services, and also what is the significance of the 1-to-30 ratio and how can we justify that. So I think in terms of the way the services are designed to meet people where they are and using a strengths-based approach is really different than traditional federal programs or TANF or things where people have to show compliance in order to be able to get benefits. And I would just tell a quick anecdote, which I think illustrates why it's so important, and I think also illustrates why it's important for people to have the ability to get to know the clients and have time. There was one of the women we worked with in Portland, and she said to me that Host was really different than the other programs she'd worked on through the Housing Authority, because before they had just told her she had to get a job, or she might lose her housing. And then when the Host case manager came and met with her, they said, well, what are your goals? What do you want to accomplish? And she said, well, I want to get my associate's degree so I can get a better job. And they gave her the time and coached her through that. She finished her GED. She then went back and got her associate's degree. I happened to meet her the week after that had happened, and she was talking about having marched across the stage, and her kids got to see her do that. And she was about to start the job that was going to pay the salary that might get her out of housing. So it's that kind of meeting people where they are and helping them set their own goals that really matters. I totally get that it's very expensive to do this kind of case ratio. One of the things we've been working on a lot as we move into more of the Host network and out of the Host demonstration phase is how do you tier services? Not everybody's going to need that level of coaching. Some people are going to be doing pretty well, and they just maybe need someone to help when there's a crisis or whether they have a meeting at their kid's school for something. And other people are going to need much more intensive hand-holding in order for them to maintain stability. So we have been working on how you do a needs assessment and how you provide tiered services So that's the people who really need it are getting the high-intensity case management. The people who don't have someone they can call when they need help. Molly asked if any of these programs have been using Housing First ideology. All of these programs that we're describing are for people who are already in public or assisted housing, so they're housed. The goal is to keep them housed and not let them lose their housing. You're not giving me names anymore. So, here's a good question about what steps they took to make residents comfortable seeking with mental health services on site. That, again, goes back to the relationship building. It really was because the case managers had built relationships with the families. Another anecdote is one of the kids from Host had gotten involved with the program, and he was really concerned about his mother. He had gotten the case manager to come to the house. She got the mother to accept the therapist coming to the house. She would not come out, and the mental health provider came in, and the time that we met her, the therapist had actually gone with her to the clinic and gotten her diagnosed and gotten her on medications. She said that she was functioning. I wouldn't say, she was not going to be independent of public housing tomorrow, but she was doing well enough that her son could feel comfortable leaving her alone, going to school. The house was clean. So they were doing better. So how much longer do we have?
We got 3 minutes.
3 minutes. Okay, I'll do one more, and then if you provide an email address to people. Yes, ma'am.
The 1 to
Go.
30 ratio, could you speak to that? I think that was one of the questions you flagged. The caseload ratio was asked. Why that?
30, because my colleague Mary Howard at the Chicago Housing Authority had come from the transitional assistance to the homeless world and had done a lot of work on intensive case management, and she brought her expertise to designing the program. So it's an evidence-based model. Everything that's in the original Host model. One more, okay. Yes. Well, let's see, there are a lot of, okay. Why did we decide that we should, there's one, can you provide examples of the gaps we were seeing in supportive services and affordable housing that we saw that brought us to decide that Host needed to be created? Really, I think one of the big challenges we saw when we first were designing Host and the original Chicago demonstration is that service providers were reluctant to go into public housing and serve public housing residents. There is still a strong stigma against public housing and the people who live in it, and they were afraid often of going in, and they wanted people to come to them. And as Tia Hicks told us earlier, a lot of people live in public housing have their own concerns about leaving and their own fear and really need the trust before they're willing to do that, or their own lack of funds for transportation. Honestly, a lot of programs are requiring people to take multiple buses to go and get to multiple appointments, so having something that's on site is really important. Housing authorities are not social service providers. We all know that, but being able to partner effectively with people who are and bring them onto the property, give them space, help fundraise together for resources, even if they don't have funding. Being able to provide space is a really critical resource. Being able to partner effectively with the providers. It doesn't mean just giving them an office and a key and saying, here you are. It means that you have to be part of the service delivery process. You have to be meeting with people. If the property managers know that they've got a hoarder who is going to be a problem when relocation starts, letting the service providers know. So really being able to create those partnerships is really important. I'm giving the signal here. So if you have additional questions, if I didn't get to your question, you can email events@urban.org, and we will do our best to respond to you in writing. You could also, I think, go through our website, right, at the new Host website and send questions. So check out what we have there, see if it addresses some of the questions, and we will one of our team will be happy to get back to you as soon as possible. I just want to end on this note. This is a picture from Home Forward in Portland. This is what we are all trying to achieve, right? Happy kids in a garden. These are kids who participated in Host, and they were part of the youth programming. And, I think that's the outcome we all want, happy, healthy kids. And that's why we all do this work. So thank you for joining us today, and we look forward to being in touch with many of you, and we will let you know about future events.